Welcome back to Cath Lab Outreach. Today we're going to talk about EKG Axis. So when you talk about axis, what you're talking about is the general flow of energy through the heart. And it should follow the general direction of this arrow. It should start in the SA node and migrate towards that thick LV muscle. So if we overlay a quadrant system over top of this, then we can get an easier idea of just by looking at a few leads where this energy is actually flowing. So we're looking at the frontal plane is what this is called. And if we just look at a couple of leads, possibly three, can we get a feel for where this goes? So let's take a look at that. Step one, first thing we want to do is look at lead one and AVF. Now remember, lead one looks from the left shoulder to the right shoulder. And that makes sense because lead one, AVL, V5, and V6, those are our lateral leads. So lead one, it looks from one positive lead toward one negative lead, the left shoulder towards the right shoulder. And that gives us a pretty good left and right axis of which direction this energy is going. If we look at AVF, AVF looks from the foot up. Now remember, your augmented vectors, they have two negative leads. So your augmented vector foot takes that red lead on the left leg, and it looks halfway between your black and your white lead. So it gives you a really good idea of north and south across that equator. When we talk about which direction is the energy flowing, we're talking about from the isoelectric line, is there more energy north of that or south of that? Anytime energy is heading towards a lead, that's the interrogating lead. So let's say lead one. Anytime energy is heading towards that left shoulder, you're going to get a stronger upstroke. If it's going away from that shoulder, you're going to get a downstroke on that EKG. So these four examples here kind of show some of the clear examples and some of the kind of questionable examples that you have to decide between. But these first two on the left are clearly up. This first one's definitely clearly up. The second one, you could make an argument either way, but more of the activity is on this upward stroke. On these last two, this first one is the third one in line here is clearly more below the isoelectric line, and this wider rhythm here is sharper on the bottom. So the first two are pointed up, the second two are pointed down. So that's what we're talking about. Is lead one or AVF primarily positive, meaning above the isoelectric line, or are they primarily negative below the isoelectric line? So if lead one is positive, we know we're going toward the patient's left. If AVF is positive, we know we're heading towards the foot, and that puts us in this quadrant here, which is entirely a normal quadrant. If AVF is positive, so we're heading towards the foot, that's good idea. But now lead one is negative, now we're heading to the patient's right. That entire quadrant is a right axis deviation. If you have if they're both negative, so lead one is negative, we're heading toward the patient's right. AVF is negative, we're heading toward the patient's torso up top. That puts us in this northwest axis. And from a compass standpoint, we can see where northwest comes from. But you also see this written as extreme right axis deviation. But what about this one here? This other quadrant has a normal component and a left axis deviation component. So how do we differentiate if we're in that quadrant? Well, we're going to bring in another lead. And if you look here, perpendicular to that normal 30 degree or minus 30 degree trajectory, lead two looks from this red lead toward the white lead. So it's looking up. Remember, lead 2, 3, and AVF, those are your inferior leads. So we're looking from the bottom of the heart. So if lead 2 is positive, we know the energy is heading this direction. That puts us in a normal axis. If lead 2 is primarily negative, then we're in a negative axis. So what does that mean? Just because we can put the trajectory, the axis, in one of these quadrants, what does that actually mean? Well, for almost 30% of it, that means it's good. It means it's a normal axis. But when we get our deviations, that can help us infer other things about other conditions. One thing is hemiblocks, also called fascicular blocks. So the left bundle branch has a posterior and an anterior fascicle. It also has a septal or medial fascicle as well. But these deviations speak primarily to your anterior and your posterior fascicle. So what you're able to learn by that are some of the connections from the atria to the ventricle in jeopardy? Do we have fewer connections tying the top part of the heart to the bottom part of the heart electrically, and we could be heading toward a pacemaker? We could be heading toward a complete heart block, someone needing a pacemaker. As someone who has COPD and that right ventricle gets stronger trying to push through that diseased lung, that right ventricle grows in thickness. So some of the energy may aim toward that. So some of these things can actually help us kind of corroborate their other comorbidities. But you look at pregnancy. Certain times normal phases of life can cause the deviation to be there. As you see in pregnancy here, or even in kids on the right axis deviation. One part that comes in handy is this northwest axis. And you'll find that a northwest axis more strongly suggests a ventricular tachycardia, VT, or a paced rhythm, because the energy is starting in the ventricle, working its way up the heart. But you'll find that VT is not that simple. VTAC can actually have any axis as part of its EKG, and you'll find that there's a lot of discussion, a lot of studies out there on different methods to determine, is this VTAC or is this an atrial rhythm that's wide? So if you take a SVT, something that's very fast, and it's hitting a wide bundle branch block on the way down, it can very significantly mimic VTAC. So axis can inform us on some of these things, but we can't just hang our hat just on the axis. So let's take a look at this one here. What's the axis of this EKG? Well, here's lead one. Lead one is primarily negative, so we know we're heading toward the patient's right. Let's look at AVF. AVF is positive, meaning we're heading towards that lead, which is in the foot. So that puts us in the patient's right, below the equator, so that's a right axis deviation. This one here, lead one is positive. That's good news. We're heading toward the patient's left. That's the left shoulder. AVF is negative, though, so that puts us heading up. So we're in that quadrant near that left shoulder that says some of this is good, a normal axis, some is negative as a left axis deviation. How do we differentiate? We look at lead two. Lead two is negative, meaning we're heading more toward the torso than the waist. So this is a left axis deviation. So just 3 leads can give us an idea of where this energy is headed, which can lead us to other interpretations for EKGs, which we'll get into later. All right, that's it. I hope this was helpful.